Well, back pain isn't just something that happens after you turn 30, as the internet and those TikTokers would have you believe. It's actually more common than we think, and it can range from sitting at a desk or on the couch all day, a wrong move or bad posture, to more serious conditions like sciatica, herniated or bulging disc, and scoliosis, or even more. Hi everybody, I'm Kendis Gibson, your host for today's discussion, coming to you from the Baptist Health Newsroom. It's not something that we actually think about, at least not when you're young, but when it happens, man, does it hurt. Here to set us straight, so to speak, on some common myths about back pain and keep our spine in line. You were rhyming a lot as well. We are joined today by physical therapist Egon Vollmer. Thank you for being here.
Thank you for having me.
Really appreciate it, doctor. All right, so let's get started. Before we dive into everything, in today's subject, by the way, I do want to remind the viewers ahead of time that to send in your questions and comments in the comment section throughout this discussion. We're here for you, and happy to answer any of your questions that you may have. But I do have questions in the meantime for you, doctor. So heavy lifting or perhaps, straining is thought to be a big reason for back pain for a lot of people, but it's not the only thing that can cause it, is it?
Not necessarily. Having a sedentary lifestyle affects tissues probably more so than the heavy lifting. So what we want to have the patients do is stay active, be as active as they can to maintain their body in check.
So when you say like a sedentary lifestyle, what's like, is it shunned upon if I'm sitting on TikTok for 12 hours a day? Is that a sedentary lifestyle, even though I'm scrolling?
Unfortunately, we live in a society where we sit a lot because of work, because of driving, because of normal situations that occur during the day. So yeah, those positions are going to place undue stress onto the tissues, and prolonged periods of time is going to lead to weakness. And that can cause a predisposition for an injury when we do have to do the actual lifting and carrying.
Okay. Is it more beneficial to have those sort of the standing desk that have become popular?
A good relationship between sitting and standing, yes, is going to be more beneficial because then you're able to offload a little bit of the spine. And the same token, you're also going to be able to stretch a little bit the muscles there in a shortened position while you're sitting. So a good balance between the two, I think, is great.
Okay, so let's talk about prevention now, and what are some ways that an otherwise healthy person can actually avoid to deal with back pain?
Activity. It doesn't have to be anything specific, to be honest. It's just we need to have the body moving. We have good research talking about walking, yoga, Pilates, swimming, even dancing. So activities that a person is able to enjoy and is able to continue to complete in a routinely way is more beneficial.
Running?
Running too, believe it or not, has impact on the spine, and we do need that impact for the fluid inside the disc to move.
Okay.
So impact to a certain extent is healthy impact as well.
And if I'm thinking then about lessening the negative impact of running, is it more important for me to run indoors or outdoors?
I don't think there's data that they can tell you the difference right now. But again, your body will tell you. You will feel it the next day. If you're feeling significant amount of stiffness and maybe even pain that you weren't feeling before, then that could be the first signs of something that might be too much of a stressor for your body.
Okay. So there are different reasons, obviously, that people suffer from back pain. Are some of it genetics?
Yes.
Okay.
Yeah.
Talk to me about that.
We have issues with arthritis we thought it was before just more wear and tear, which it is to a certain extent, but there's a predisposition for it as well. The other conditions as well, there's going to be osteoporosis that can affect the spine, and it's going to lead to some sort of pain as well. Anything that affects the bones per se might have a genetic factor as well.
And I have friends who, when the weather will turn a certain way, they'll be, "Oy, my sciatica." Is there anything to that or no?
Not in the literature. However, for the amount of time that I've been practicing, I can tell you there's definitely a relationship. Patients either will tell me they know when it's going to rain, or they're going to tell me they know when there's going to be too humidity or like a change on the weather.
Wow.
So there isn't anything documented, and I know there's research into it, but nothing clear cut as of yet.
Wow. Okay, but there's not research, but they know when it's going to rain, and
I've seen it. So.
all right. We should get the lottery numbers from them while we're at it. So social media made me do it, or I saw it on TikTok. You've probably seen or heard all of these. It's popular these days, and we're seeing a lot of people cracking videos. There's this one. I haven't seen it yet, but I want to get your. Let me turn up the volume.
And out. Breathe out all the way.
Oh.
Did you wait, let me play that so you can hear it one more time, because
Okay,
it's just it's as painful to watch
Breathe
as you
out
hear.
all the way.
Oh my god. Does that make you cringe as a DPT, doctor of physical therapy?
Maybe I'm more exposed to it, so I don't want to say it's abnormal, but it definitely could be if you're not familiar to the noise.
But I mean, what are the pros and cons of seeing things like that, or pros and cons of going to a chiropractor?
The pros is you're gonna go to somebody that has a license, and they've gone through schooling to be able to do that.
Yeah.
And there are parameters that must be followed to in order to be able to do a manipulation. And if you have someone that you trust, then that should be the person you see. However, if you're going to somewhere that's the first line of defense and there's no real evaluation into a concept, then that's a con into what you want to do, because you're treating something with dynamite. So we don't know what the effects are going to be, and they might be negative to that patient.
Yeah. Well, I know that you've spoken about the wonders of physical therapy to relieve back pain. What are other non-surgical treatments that you would recommend?
With therapy, there is a little bit more research into dry needling, so that is something that is being looked into on I want to say, the last 5-8 years. Mm-hmm. Also, we do same thing as a chiropractor. We do manipulations into high velocity, low amplitude mobilizations for the cervical spine and for the lumbar spine as well. Soft tissue, and then myofascial releases that we do as well. All they can help modulate the pain, so aid with the use of medication.
Is there science behind acupuncture?
It's,
okay. I'm not going to get you in trouble with it.
There is. I mean, it's something that's been going on for thousands of years, so I do not discredit it, because if it has been alive for this long, it's for a reason. And I think done by someone that really knows what they're doing, it might be something beneficial for a certain candidate that might be seeking a little bit of relief.
Okay, so I'm curious. Do you always sit upright?
I always stand up. I don't sit that much at work. Yes.
So if I'm trying to do proper posture and I'm sitting at a desk, what does that physically look like?
You want to feel that you have like a strength, so you're able to pull yourself up, and then you feel you're standing a little bit taller. It is hard to maintain the posture, to be honest, because there is going to be a fatigue component to it. But the more you're aware of it, the more you're going to be able to do it, and then maintain some of that balance and decrease the undue pressure onto the tissues.
Okay, and if I'm sitting on the couch watching TV, is there a better or less positive option of how to sit?
Challenging, because I'm assuming if you're watching TV, you want to relax, and we all want to relax to a certain extent. Yeah. But your body will tell you. Your body will tell you. You'll feel pain. You'll feel discomfort. Not a nice stretch. Not a nice position, and that will be the situation when you want to get away from those type of postures.
And then what about stretching? What are some stretching exercises? Like, say I had a rough night of sleep and my back is starting to hurt. What are some stretching exercises that can prevent those things from happening? Or are there?
I give my patients a few exercises that I think they're powerful enough they're able to do it, so at least they decrease some of that stiffness in the morning. So laying on your back flat as you wake up, bringing your knees to your chest, do one at a time, do a few repetitions on one side. Do pelvic tilts where you're moving the pelvis a little bit so it starts to get some of that movement on the spine. I wouldn't go too much into stretches right away in the morning because the tissues are going to be a little bit stiffer.
Yep.
But anything mobilizing the spine is going to be more beneficial.
And definitely stretch before a workout and after?
Literature says afterwards.
Okay.
Any static stretches, you want to do it afterwards because if you do it beforehand, you lose about 10 to 15 of your strength. So you're predisposing yourself to injury by doing a static stretch. What they'll tell you right nowadays is to do a ballistic type of stretch. Just to get the tissues going and then warming up the body.
So that's my excuse. It's like, it's because I stretch. That's why I can't do that extra set.
You're supposed to stretch afterwards. Yes.
that's what I'm going to tell my trainer. When do I know that something has gone from just being a nuisance to being something that is needed for me to call you or someone else?
Anything that you seem that it affects your activities of daily living. If you're having difficulty nowadays to get up from the bed, something you were able to do a week ago, 2 weeks ago, a month ago, then you definitely want to see us. Anything that's affecting your ability to do sports, do your job, those are the situations where you want to seek advice from a professional.
Okay, let's get some of the questions from the professionals, really, our viewers right now. Some of their questions include, can constantly sitting on a fat wallet cause a back pain? Like, how fat is your wallet? But can that cause back pain?
So, not necessarily back pain, but it can cause symptoms down the leg. So, that area is where the sciatic nerve actually branches out. Okay. So it is a little bit more superficial. So if you have something that's putting pressure into it, it's going to cause numbness and then it can start causing symptoms into the nerve. Just like with prolonged sitting, it can cause ischemia and then that can cause changes to the nerve and then that can become an issue.
What about women constantly carrying a big purse?
I want to say, unless it's a very, very heavy purse, then actually turns you to your side, then it might be a little bit of an issue because it's creating an adaptation to something. But on the same token, if that person is strong enough, has good muscles on the back, her abdominals and everything, she should be able to keep that posture in a more neutral position.
Okay. Soft or hard mattress?
I don't have anything for that.
But does mattress make a difference though, right?
Not that I know, to be honest. I always tell patients it's just like shopping for shoes. You want to try them on and see the ones that you feel are good for you. And then kind of branch out from there. The same thing with the mattress. You want to feel something that is comfortable for your body. I think the issue that happens is most people have a partner. And then that person tolerance to a mattress is different to the next one. So it tends to be more of an agreement more so than the preference of one versus the other one.
Yeah, then there are some of us that have the dog that you sleep depending on where the dog wants to sleep.
Yes.
So, story of my life. All right, Doctor, appreciate it.
Thank you so much
Really
for having me.
appreciate it. This has been a great conversation, so we really appreciate you being here and explaining all of that with our audience. And do remember, by the way, be sure to hit that subscribe button on our channel here to keep up with the very latest health and wellness information and tips from our experts, like Dr. Vollmer. You can also connect with us on social media channels, Facebook, Instagram, Twitter, and proper TikTok videos, as well as LinkedIn. And check out our resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all episodes of the Baptist Health Talk podcast as well. On behalf of everyone at Baptist Health, stay safe, stay healthy. Thanks for watching.